Hello dear viewers, welcome back again in Glittering Biology. Today once again we are just going to discuss few topics related with the chapter that is digestion and absorption. And in that series of lectures now we are just going to discuss about the disorders of digestive system, protein energy malnutrition, indigestion, constipation, vomiting, jaundice and diarrhea today. But before that one, I would like to discuss little bit about the vitamins again. Here you can just see on page number 16.34 few more vitamins are given which we missed on the last turn, that is the vitamin A. It is chemically known as the retinol. The main source of this vitamin is the fish liver oil, and it is also obtained from the yellow food like the maize, carrot, papaya. Green leafy vegetables are also source of the vitamin A. They are just special substances for providing the visual pigments like the rhodopsin and iodopsin of the retina. Their maintenance of normal living secretory epithelium in mucous membranes of eye prevents keratinization of eye epithelium. This is a very important vitamin which is causing different types of disorders in its deficiency, and the main disorder which you have earlier studied, that was the night blindness. Add one more in that one, that is the xerophthalmia, dry cornea, no tear secretion is just observed in this condition. Vitamin D, calciferol, very common vitamin which can be synthesized through the sunlight by our skin, and here it is also obtained from the shark liver oil and eggs. What it is doing, synthesized in the skin from the cholesterol derivatives by UV rays of sunlight, increase intestinal absorption of calcium and phosphorus, important in bone and teeth formation. This vitamin is important in teeth and bones formation, and generally it is causing disease related with the body. That one is called as the rickets. In children it is just called as the soft and deformed bones, and osteomalacia, that is in adults, related with the soft bones. Later on, vitamin E, that one is the tocopherol. It is related with the reproductive system of our body. That green vegetables, brown flour, germinated wheat and seeds, they are the resource of the vitamin E. Act as an antioxidant, maintains body muscles and also fertility, supports in the prevention of hemolysis of RBCs. Here you can just see what deficiency causes related with the vitamin E: reproductive failure, muscular dystrophy, increased hemolysis of RBC leading to the macrocytic anemia. Macrocytic anemia is another disorder whenever there is a huge amount of RBCs are unable to complete their lifespan and they are destroying itself very quickly. And vitamin K, that one is the phylloquinone, that is provided by the leafy vegetables such as the cabbage, spinach, coriander, radish, also synthesized by the bacteria of large intestine, required for the synthesis of the prothrombin, and it is related with the blood clotting, means it supports the blood clotting. That is important to know. Now later on there is a one more heading, it is given about the balanced diet. What means of the balanced diet? Balanced diet is that diet which provides proper amount and proportion of all the nutrients present in the food, that are proteins, carbohydrates, minerals, vitamins and along with water for the daily requirement. So for a specific body there is a amount of these nutrients is fixed for the its proper functioning. The nutritive value of such balanced diet is about 3000 calories. This diet contains 90 gram protein, 90 gram fat, 450 gram carbohydrates and other substances. Here it is given few charts, in which upper chart is just representing the diet required for the male and the female in adults per day, and the lower chart is representing for the children of different age group, what they required in their diet regularly. This entire food material, means this entire diet is also having the energy along with that. The energy accumulated in food substances, which contains the proteins, fats and the carbohydrates, that is expressed in calories or kilocalories, and the concept which one is related with the expression of such values of these nutrients is just called as the calorific value of food material. The caloric values is determined by the presence of unoxidized atoms of carbon and the hydrogen. I would like to tell you 1 gram of fat is able to produce 9.3 kilocalorie energy in the comparison of 1 gram of carbohydrate and proteins, which are capable to produce only 4.1 kilocalorie with 1 gram. Now the main topic which one is related with the syllabus, that one is the malnutrition, undernutrition and the obesity. In this one, malnutrition word is representing what? The malnutrition word is representing the deficiency of these nutrients in the diet, or you can just say that one is the faulty nutrition. Faulty nutrition, it is caused due to the eating poor quality of food which is rich in some but poor in other essential elements. So in that case, suffering from the malnutrition, which is just representing the poor intelligence, that poor muscle development, dry and cracking skin, dullness, etc. Under nutrition, inadequate nutrition is also one word given here. What it is means insufficient quantity of nutrition in the food. A child who is 10% or more below normal or standard weight for height, that is considered to be the undernourished. And here the reason for the undernutrition, it is given about the poverty, overpopulation, improper methods of cooking are also related with this. Obesity, it is the excess of energy eating rich food in their diet causes the deposition and it leads to the obesity. It is the main cause for the heart problems, increased level of cholesterol and diabetes. Nowadays, junk food are the main source for the obesity. Nutritional and the digestive disorder, whenever we will just talk about, at that time we will classify them into the different categories. The first category, it is given about the deficiency disease, and here we will just talk about the protein deficiency, vitamin deficiency and mineral deficiency. So in the protein energy malnutrition, what it is? It is potential fatal body depletion disorder. Here protein caloric malnutrition, it is also called, leading to the death in children in developing countries. In children and adults whose consumption of protein and energy is insufficient, they are just considered under this topic. PEM is two types, primary and the secondary. Primary PEM results from the diet that lacks sufficient source of protein, while secondary PEM is more common, where the usually occurs as a complications of AIDS, cancer, chronic kidney failure, inflammatory bowel diseases, etc. Here, the protein malnutrition disorder, whenever we will just talk about this, then it will be kwashiorkor. Kwashiorkor is the term for this one, called as the wet protein energy malnutrition, is from the PEM, characterized primarily by the protein deficiency. This condition usually appears at the age of about 12 months when breastfeeding is discontinued, but it can develop at any time during the child's formative years. Kwashiorkor is characterized by the hypoalbuminemia, edema, and fatty liver. A person suffering from the kwashiorkor should have more meat, butter, milk, and eggs in his diet. Means these are, by this we can just control the condition. Marasmus is the next one, is which one is just considered under the protein energy malnutrition disease, that is caused by the prolonged starvation resulting the deficiency of both protein and calorie. It results massive loss of the muscles, fat, thin limbs, prominent ribs, dry, wrinkled, and thin skin, and diarrhea. It is the disorder which has been developed between the age of 6 months and 1 year in children who have been weaned from breast milk or who suffer from the weakening conditions like the chronic diarrhea. Later on, vitamin deficiency diseases, which we have already discussed. Here you can just keep the 4 examples: vitamin A, vitamin B, vitamin C, and vitamin D, and its deficiency diseases. Next, it is about the minerals. So minerals, in that one you have one example of the iodine. In the previous class you have heard about the iodine deficiency causes that simple goiter. Along with that, calcium and phosphorus, it is also very important. Sodium and potassium, it is related with the hypokalemia, dehydration, and extreme muscle weakness. Fluorine, tooth decay. Zinc, anorexia, and iron is causing the anemia. While the calcium and phosphorus, rickets in children, means that one is related with the bones problem, bone related problem. And later on we will talk about the indigestion, also known as the dyspepsia. Dyspepsia is a vague feeling of discomfort in upper belly or abdomen during or right after eating. It is a common in adults, can be caused by the condition in digestive tract such as the peptic ulcer, disease, cancer, or abnormality of the pancreas or bile ducts. It is triggered by consuming more alcohol, eating spicy, fatty, and greasy foods, eating too much, eating too fast, high fiber foods. Next, it is about the constipation. Constipation, what it is? Means that the person has 3 or fewer bowel movement in the week. With constipation, stool are usually hard, dry, small in size, and difficult to pass. What are the reason behind that one? Not enough fiber in the diet, the lack of physical activity, more or less intake of milk, irritable bowel syndrome, that is another cause for constipation. Next is vomiting, known as the emesis, is the forcible involuntary or voluntary emptying of stomach contents through the mouth. The feeling of having an urge to vomit is termed as the nausea. And gastroenteritis or food poisoning is another term for common cause of vomiting in adults. That pregnancy can cause vomiting also, and vomiting that is associated with the head injury, vomiting of blood, dizziness, weakness, or change in the level of the consciousness can be symptom of the serious, potentially life threatening conditions. So that is all over about the today's content. Hope this lecture, hope this series of lecture is clear in your mind. prepare your notes according to the revised syllabus of council, not in excess. Thank you everyone.